It's lovely today to see so many familiar faces and many new faces. We are all grateful for you coming out to our annual Lancaster benefit auction. I'd like to share one family's story today in order to describe the clinic's long-standing commitment to community and commitment to improving the quality of life of many we love. In 2002, Levi and Emma traveled from southern Pennsylvania to bring their son Mark to see Dr. Strauss at the clinic. Mark was 4 years old at the time. He was frail, socially detached. He could not fix his eyes or follow things, and he did not respond to any sounds. Blood work that day showed that Mark had a deficiency in an enzyme called 5,10-methylene tetrahydrofolate reductase, or MTHFR, a disease also known as homocystinuria. This is an important enzyme in recycling an amino acid called methionine and in creating something called methyl groups, which are both critical in brain development and function. Dr. Puffenberger, our laboratory director, found the spelling error in the gene that produces the MTHFR enzyme. We all have 2 copies of every gene, and both of Mark's copies had this error. With the help of another colleague named Dr. Harvey Mudd at the National Institute of Mental Health, we developed a plan to treat Mark with an over-the-counter supplement called betaine. This gives the brain the methionine and the methyl groups that it needs. Within only weeks of starting betaine, Mark took his first steps ever, and for the first time responded to sounds and light. Amazingly, betaine powder costs less than $1 a day to treat. But it matters that you have to know which supplement you need to use, which special vitamin that can help his body with the methionine. Dr. Strauss and Christine Hendrickson, one of our nurses, traveled around the community of Levi and Emma, collecting blood samples and sending them to Dr. Mudd for analysis to figure out the exact dose needed to give these children's brains the methionine they needed. They were able to identify more than 3 other children from the same Amish settlement with MTHFR deficiency and treat them with betaine. They were also able to see these benefits. They found that 30% of the community, that small community, were also carriers, meaning that more babies were on the way in future years. In 2007, we published this research to share with others around the world who may also have MTHFR deficiency and are in need of a treatment. Levi and Emma's next baby was born in September 2003 and also had MTHFR deficiency. Ruth was born and started on betaine right away, just in the first few weeks of life. She's now an adult with normal brain growth and does not have the health troubles of her brother from the first 4 years of him being low in methionine. This is the power of knowing ahead of time and preventing illness. Small communities like this can have an increased risk of genetic disease due to common ancestry. The key is to anticipate, to know ahead of time about these diseases, and make a change or intervene before any symptoms occur, and ideally to prevent symptoms from ever occurring, just like with Ruth. In 2019, we partnered with a technology company called Archer DX to create something called the Plain Insight Panel, or the PIP for short. This is a genetic test that we run on couples, young couples who are expecting children, so that we know what their risks might be and if they are both carriers for the same disease and could possibly have a baby with that disease. Just a few months ago, we launched the third version of the Plain Insight panel. That we are continuing to update the panel, make it better and more informative and more useful for families. In this way, the more we do PIPs, the more we can understand the community's genetic material, and the better we can help prepare expecting parents for a child and help to prevent disease. So this helps the local community because we can then know and have a rapid diagnosis within hours of a baby being born. And it helps globally, the community at large, because we are discovering new genes and new disease-causing genes, and we're able to share that beyond this community. The PIP has financial implications too. In the case of MSUD, or maple syrup urine disease, toxic chemicals build up within hours of a baby being born. If MSUD is not treated properly, the baby will be in a coma within a few days. The newborn screening heel prick test does check for MSUD, but the results are not available until the baby is 5 days old, when the baby would already be on life support and with brain swelling. But with carrier testing through the Plain Insight panel, we can avoid this crisis. We can get a sample of umbilical cord blood from a newborn baby and bring it to the clinic to have a diagnosis of MSUD within just a few hours. We can start the specialized treatment, which is a special metabolic formula, a special medical food, and prevent the baby from ever going to the hospital at all. Between the years of 2008 and 2018, we studied 25 babies with MSUD. 18 of those babies, we knew that the parents were carriers, and we had a window of time and opportunity to treat immediately. 7 of those, it was a surprise, and we found out on newborn screening. In those that we knew about ahead of time, they spent an average of only 8 hours in the hospital and were diagnosed at an average of 12 hours old. While the other 7 that we did not know about ahead of time, those babies required intensive hospital monitoring for an average of 7 days, not getting diagnosed at all until 5 days old with newborn screening, and gathering an average hospital bill of $100,000 per baby. Although the PIP costs us about $500 to run, we offer this test at $150 to ensure that this life-saving test is affordable to those who need it. If we can prevent just one hospital stay of $100,000 by using this test, that money can go to pay for over 660 PIP tests for 330 couples. Now we know that of those who do the PIP test, about 1 in 5 will be matches for something. And that means that we might have the possibility for those 330 couples, almost 60 of them will have a match for something. And that means that 60 babies will have access to earlier treatment, sooner diagnosis, and that matters. This is all from the savings of that one hospital stay from one of these tests. One more comment about Levi and Emma's story. The clinic was founded on the principle of local care. For a community that drives horse and buggy, traveling up to 100 miles for special health care in a big city doesn't work. For some families, even the travel to Lancaster County for frequent visits for an ill child becomes a challenge. For the past several years, we have had a quarterly or monthly presence in Somerset County and Union County, Pennsylvania, in the form of what we call outreach clinics. In fact, the Somerset Outreach Clinic began after the clinic's work with Levi and Emma in their community. Our outreach program manager, Christine Hendrickson, organized these clinics and ensures the same level of care is delivered there as at our home location in Gordonville. To reach more people, we recently opened a new location in a new outreach clinic in Newville, Pennsylvania, and Dr. Grace Meyer and Christine had their first outreach clinic there in May. We also anticipate dates later in 2025 for outreach clinics in New York and Missouri. I will close by thanking each one of you for coming out today in support of the work the clinic is doing. Thank you to the auction committee for spending countless hours in preparation for today. Thank you to the volunteers who are working so hard on this very warm day. Thank you to the businesses for generous donations. And thank you to each craftsman and woman for donating your gifts and talents in the forms of quilts, woodworking, and much more. Today, we all participate in furthering the clinic's mission to improve the quality of life for those with genetic or complex medical conditions through innovative research, accessible laboratory services, and compassionate care. I just want to draw attention to the fact that on the back of your bidder card, there are a list of a few services that we offer at the clinic, and the cost of those services is listed. If at the end of the day when you pay your bill, if you would like to add an additional service to the next child and pay it forward, you may select that and they will add that to your bill. This is one way that you can continue to support the work that we do at the clinic every day. We thank you so much for being here, and I hope you enjoy this lovely day.